At 4:30, long-term side effects from COVID-19. We have heard a lot about this over the past year, some not as severe as others, and a new program just launched at Yale New Haven Children's Hospital trying to help those suffering from them. Joining us live, Dr. Paintsil with Yale New Haven Hospital. Dr. Paintsil, thank you so much for being with us.
Thank you very much for having me.
So first off, what are the main long-term side effects that you are seeing these children experiencing?
So we are seeing children having prolonged fevers. Some of them are also have had symptoms like palpitations and also chest pains. They may have shortness of breath. Some are having knee or joint swellings. And some are also unable to go to sleep. And we are seeing uptake of mental health issues as well.
Yeah, those are some pretty rough, lingering symptoms. Can you tell us, Doctor, a little bit more about the new program and how you think it is going to help these children who have been suffering for far too long?
So the new program actually was born from one of the lessons that we are still learning from COVID-19. That there is really a need for effective and high level of engagement with communities and also community advocacy by hospitals and healthcare providers. So during this pandemic, Yale New Haven Children's Hospital has been speaking to the community. We've been talking to community pediatricians and other stakeholders, and we have been listening to the families of our patients. And we realize that most of them are having these issues post-COVID infection, and there is really no avenue to address. So that's why we put together this comprehensive program where all the symptoms and more that may be found later could be addressed.
For parents who are watching right now and want their kids to be a part of this program, how can they enroll? How do they get involved here?
So we have a one-call center, and the number for them to call is 877-925-3637. When they call this number or the Yale New Haven Hospital call center, they will be triaged and brought into the program. And the program is actually manned by different specialties. We have different providers, cardiologists, infectious disease, immunologists, we have psychologists, psychiatrists, we have counselors, nurse coordinators. So they would help that parent or child be placed with the services that they would need.
I want to ask you one more question before you go, and I know there still needs to be a lot of research and data in this particular avenue, but a lot of children are still not eligible for the vaccine, only those 12 and up at this point. Do you think that for those who are experiencing these long-term effects, if they do get the vaccine, this could hopefully mitigate some of those symptoms?
Yes, exactly. I mean, most of the symptoms are occurring post-natural COVID-19 infection. So if you have the vaccine that will prevent natural infections, that would imply that you will be spared of this long lingering symptoms that we are seeing in some of our patients. So the vaccine is definitely a sure breaker.
All right. Well, that is certainly some good news and good to know. Dr. Paintsil, pediatric infectious disease doctor with Yale New Haven Hospital. Thank you so much for being with us. We appreciate it.